right, good afternoon, everybody. What we'd like to do is walk you through our model by which we've been preparing for this COVID surge and let you know what our preparations were and what the assumptions they were based upon and how we came to the conclusions that we did. Deborah Birx, who you know is the White House COVID coordinator, said yesterday that Connecticut will be one of the next hot spots. And we've been trying to explain to Washington for some time that Connecticut, southern Connecticut, is one of those hot spots and has been for some time since we're part of that greater New York metropolitan area. Let's go to the next slide, planning ahead. What this is meant to indicate is that this planning right now and the models that we're going to walk you through are what we base our estimate for peak hospitalizations, and that's very key. And when we talk about a surge, you're going to see it's not one of those lines, but it's a series of rolling apexes, and that's how we've tried to coordinate our response. When I say coordinate our response, as we've described over the last couple of weeks now, what we're doing in terms of hospital space, what we're doing in terms of staff, two places where we have a fair amount of control, and what we're doing in terms of stuff, just getting the PPE, the beds, the food service, and ventilators, and where we came up with those assumptions for those. And these models, as the slide says, are estimates, could be better or worse. I'll try and tell you why I think we could do better, and my friends here will bring me back to reality on how they could be worse. Here's the daily hospitalizations. This is worth saying a couple things. It was exactly 4 weeks ago that we had our first COVID infection at Danbury Hospital. And this first slide represents where we see the peak for Fairfield County. Fairfield County, as you know, being closer to Westchester and closer to New York, is where the virus hit Connecticut first. I'll tell you, overall in the numbers, they're sort of interesting. We've had some positive indicators in terms of percentage of infections and number of infections over the last 4 or 5 days. That changed today. We've had 1,000 positives recorded out of 1,715 tests. So what that means is our number of positives went up about 29%, which is probably more than we've seen in the past. And a little disturbingly, the percentage of tests that resulted in people positive spiked up at 64%. We now have a total of 20,000 tests and 4,900 or so positives. But remember, these numbers are bouncing around. Number of hospitalizations went up about 82 to 909, and that's a little less right now, and we can talk about that in a minute. And fatalities, another 19 poor souls, and up to a total of 131. And maybe there's some anecdotal evidence that in certainly the southern part of Fairfield County, the places that were first hit with COVID, the places that have maybe the longest experience with social distancing, there's been some slight moderation, but it's really too early to speculate on that. But I think you see Fairfield County, we see the surge sometime in the next 2.5, 3 weeks. In the next slide, we're now going to go to New Haven County. And again, New Haven County, two things are indicative there. Probably the surge is going to be 2 or 3 weeks after, say 2 weeks after where we are in Fairfield County. And again, you'll see that gives us a little bit of planning room in terms of how we allocate resources between hospitals. And you'll see their peak of the apex is a little less. And it's a little less, our models show, because it reflects mainly, lower density, and which could mean a game changer for bringing down the peak overall. Our next slide is Hartford County. Again, out another 2.5 weeks. Again, the peak is less. Again, that probably mostly reflects density and to some degree social distancing as well. And the last slide, which you should see there, is Eastern Connecticut. good time to be in Eastern Connecticut. It's the lowest density area, the place that will be last afflicted by the COVID virus. And you see a much lower surge in Eastern Connecticut. And again, that probably overwhelmingly reflects a little bit more time for planning, a little more conscientious, perhaps on social distancing, but most importantly, lower population density. Let's go to the next slide. I think I can speak to that. So what we have in this slide is sort of a composite of where we are measuring those 4 different waves that we just went through, the 4 different apexes that we have to plan around. And you'll see in this slide that overall, at its peak, we may need a total of 12,000 COVID beds if nothing changes due to social distancing or technology, and 4,000 ventilators. Let me talk about the one that we control first, and that is beds. As you know, or maybe I can remind you, we've got about maybe 7,000 beds overall in the state of Connecticut, but only 4,000 of them right now are COVID ready, so to speak, ICU ready. And, but through the good work of our hospitals, working in collaboration, working as one, and by working as one system, it gives them much more flexibility to be able to address the needs where they are. I think they're going to be able to increase their capacity. I said by 50% a few days ago, maybe even a little more than that. Maybe we can get up to 3,000 additional beds, doubling up, finding the ambulatory care, finding the non-urgent beds, finding that in terms of PPE, finding that in terms of critical care beds, and expanding our capacity from, say, 4,000 to 7,000 beds. In addition, our nursing home population has been shrinking, as I pointed out before. We can talk a little bit more about how some of our COVID patients in those nursing homes are going to go to a COVID-specific nursing home or a specific wing just to make sure there's less cross-contamination. But just as importantly, out of these empty nursing homes or non-used nursing homes, we're going to upgrade them and get another 1,000 beds there. And finally, you see that we've got the surge hospitals. You saw what we did down in Southern Connecticut, and now we're in Central Connecticut, and down in Stamford. And those will be for intermediate care, folks in recovery from COVID-related. So as needed, we can get up to those 12,000 beds if that's a peak of absolutely what we have to do. Ventilators, you see that 4,000 ventilators is taking a little more work. Ventilators, as you probably know, and I said yesterday, we have a little over 1,000 right now. We got 50 ventilators from the national stockpile, and you know, New York City got 4,000 ventilators. So we're working every day to see if we can get some more ventilators. I think you probably know that we have a ventilator manufacturer here in the state. Maybe we can ramp up production there and get ourselves some more ventilators, working what we can out of the federal government, scouring the globe for what we can. Working with our hospitals, and manufacturers have been incredibly creative in terms of see how we can get multiple use out of one ventilator, say being able to serve 2 patients of a comparable situation. I've also been talking to Dr. Murphy down in Newvance, and you know, he was explaining how we allocate ventilators. Sometimes ventilators are necessary, sometimes maybe more high-flow oxygen and other alternatives. So we're going to stretch our use of ventilators as best we can, and probably just as importantly, as you see from those apexes as they rise over a course of 6 or 8 weeks, it could be that some of the ventilators are going to Fairfield County today, and in 6 or 8 weeks, they'll be going to Eastern Connecticut. So we'll be able to mix and match and increase our allocation there as well. Last thing you see on the game plan, a couple of things. One, there's an extraordinary difference in infection rates and how fast this spreads between, say, Seattle, Washington, and New York City. And there's some early indications that perhaps our social distancing is working, and I cannot impress upon you enough how serious this is that you follow those dictates. I told you in the last couple of days we're We're a lot stricter with a lot of our stores, grocery stores, Walmart and the such, very clear about the number of people we can have. And people have been honoring that in a pretty serious way. And where they haven't, police have been telling them this is what you got to do. If there's any way you don't have to go into a store, don't go in the store. If you absolutely do, just one member of your family. These are sort of key priorities. As you also know, I mentioned yesterday, no more social travel, by which I mean hotels, short-term rentals are reserved just for first responders. So much of the virus travels when people travel, and we're trying to do everything you can to keep you stay safe, stay at home. That includes people in this state, and that includes anybody thinking about moving to this state. I'll just tell you, we're also working on some new testing therapies that I think are going to make an enormous difference. You see the preparing for the exit strategy and building surge capacity. We've ramped up our testing quite a bit. You see, we did a lot of testing yesterday. I'm really pleased to be able to announce to you today that Semaphore, which is a Connecticut-based company, has just announced that they're going to be able to add another 250 tests for us by tomorrow, and by next week, we hope they'll be able to get up to maybe 1,000 or 1,250 tests. And that's enormous, because that frees up beds, because we find out who is COVID and who is not, who needs that ICU bed, and who can go somewhere else. And it's freed up over 40 beds for us in those 4 hospitals in southern Fairfield County just in the last few days. You've probably heard a little bit about Abbott Labs and their 15-minute test. And there, through some real outreach, us to them and them to us, we are really pleased that we are one of the first states where they're able to get their 15-minute tests in operation. They're doing that right now down in Stanford Hospital. So people go into ICU, we're going to be able to tell immediately or within 15 minutes where they should be going. Again, that frees up capacity. Testing for nurses and first responders as we gear this up a little more so they know they're safe, and we can be a lot more methodical about how we allocate people there. Other new therapies that we're looking at, the hospitals are looking at, you've heard a lot through the media probably, hydrochloroquine. That is being used in a modest way just with a doctor's prescription, but there is some effect that maybe it is mitigating and helping people get out of the hospital a little bit sooner. Obviously, that's for lupus, and that's for arthritis, and that's for malaria. But over the next week or two, there could be an increased flow. So there are a lot of ways that we can move that dial and make sure that when it comes to hospital beds, when it comes to our capacity, what you see in those 4 waves of the apex, we're able to build there. And obviously, the toughest one for us to be able to thread that needle is on ventilators. But again, I think you see some ways where we'll be able to mitigate that effect as well. So I'm really confident that working together, working with all of our hospitals, working across the state of Connecticut, we're in as good a position as we can be given these circumstances, and everything we control, I think we're controlling in a very thoughtful way. I've been so proud of the people of Connecticut and so proud of all the commissioners. We're on the phone with each and every one of them today. You know, with that, I can say, Josh, if there's anything you'd like to add, or we can take some questions.
Take questions.
How did you finally feel for the federal government to recognize we're a potential hot zone? You've been saying it all along, and now it's here, and you see the waves for the federal government to admit that.
It's important, and I'd like to hope that they act on this. Now that they've recognized we're part of the hot zone, now they see what the infection rate is. I believe they still have some ventilators down there in that stockpile, and I think they ought to be prioritizing Connecticut along with the other hot zones.
Have we received any expired PPE from the national stockpile?
Not that we're aware of.
The way that we're hearing how things happen is that a testing center figures out that a patient tests positive for the coronavirus. That is then sent to the Department of Public Health. The Department of Public Health has to manually input that. Then it goes out to the local health departments. Then the local health departments are able to put that out to dispatchers so that they know when they send out first responders, they are going to a place where there is a positive coronavirus test. What we're hearing right now is that going from DPH, where the testing center sends it to DPH, DPH has a 7-day lag right now inputting it manually and then sending it out to local health departments. So what's happening is what we're hearing from those on the ground is that they are going to places that the state knows tested positive, but the first responders don't, and it's putting them at jeopardy because they don't know that they need to take the extra precautions. Are you hearing that, and what is DPH doing to try and reduce that 7-day lag?
Want to start with that? Dr. Carter?
Hi, I'm Dr. Matthew Carter. I'm the state epidemiologist. All of our large commercial laboratories report to us electronically, so there is no delay if it's coming from Quest or LabCorp, and it's brought right into our system and accessible by local health. I'm not aware of a 7-day delay. Some of our, the smaller laboratories that have recently come on board are sending us Excel spreadsheets, which we upload into our system. We do not have to enter most of the laboratory results that we have by hand. So I am not aware of a 7-day lag that you're describing.
From DPH to the local health departments, it is day of, you were saying?
As soon as we have it, the local health department has it. There's no delay. We share the same system. All of our local health directors are part of our electronic surveillance system. So the moment it is brought into our system, they see it.
And remember, the Abbott lab test is going to be an expanding piece of our testing. That's almost in real time. What a difference that's going to make.
Can you tell us more about the baby and how the baby died, if the baby possibly died of other causes and was also COVID positive?
Want to speak to that, either of you?
Yeah. Well, first off, cause of death is determined by the Office of the Chief Medical Examiner, and that is their task. Public health surveillance is very different. Our purpose is to try to identify people who test positive for COVID-19 so that we can implement control measures. So anyone who tests positive, contacts of that person need to be in quarantine. So our definition, what we're counting at the State Health Department, is different than what the medical examiner counts. I don't know the cause of death of this person that you're talking about, or any of the people, because we don't determine cause of death. We define laboratory confirmed COVID-19 associated deaths as anyone who has symptoms of COVID-19, test positive on a COVID-19 test before or around the time of death. We do not determine causality, but that is our determination for public health purposes. The medical examiner has a totally different job, which is to try to determine causality. And you'll really need to talk to him about the cause of death. And my understanding is, and having worked with all the medical examiners for the past 35 years, determining cause of death is not always easy and can sometimes take weeks to months.
Is it still accurate to link the death to the coronavirus?
Well, from a public health perspective, every COVID positive case that we hear about requires a public health action. So if someone dies and they test positive for COVID-19, for us in public health, that means we are still reaching out, identifying contacts. We do not, in any of our statistics, if you look at how we do flu surveillance, it's done the exact same way. You go to our website, you look at our weekly flu report, we list influenza-related deaths. This is how public health does this across the country. We do not try to, we have our role, we have our job, the medical examiner has his job, and they're very separate, and we count different things.
What we do know is that little baby tested positive for COVID.
Do you know who the new positive cases are? Are they frontline workers? Are they nursing homes? Because we've heard reports a lot of nursing homes are testing positive. Any idea who those big bucket of new test positives are?
Do I individually know who all those people are?
They're more like frontline workers. They're the most severe tested. We've heard reports of 44 people in a nursing home having tested positive in one nursing home.
What we get in a laboratory report form is essentially name, sex, date of birth, address. That's it. We may get race, ethnicity, but those are filled in probably less than 50% of the time. That's what we get.
So are you going to begin reporting ethnicity or race along with these numbers, or that's not something that you receive?
Because the medical examiner is providing us with information on deaths that he receives. They receive very detailed information that concerns race and ethnicity, and that will be in today's update. That will be included in the update that's posted at 5 o'clock today.
Let me just add, if I could, we're doing everything we can to upgrade the model and get more real-time information. So that's why I'm so excited about the possibility of the Abbott Labs 15-minute test. So we don't have these buckets of results, some of them coming back from 3 or 4 days ago, and you go, what does this mean? We're going to have much more control over that. In preparing for our exit strategy, we've also placed the largest order for smart thermometers. You know, what the heck am I talking about? These are thermometers that are Bluetooth connected to your iPhone. So the moment you take your temperature, before you go to work, before you go to electric boat, before you go to that hospital, all of that information is uploaded in the cloud. So we're going to have in real time models that tell you where this virus is going, where it left, and maybe where it's coming back in September or October. So this information is not going to have a 5-day lag. It's going to have a 5-minute lag.
Just to be clear on that, you are confirming or not confirming the 44 at the nursing home that Bob mentioned? In other words, you would know that, correct?
It's in our today's report. I believe the number is 46 or 48. I'm sorry, I don't have it.
We'll get that right to you.
Yeah. Have at least one COVID-19 positive case.
Okay.
And that'll be in the daily update
The
that
daily update.
comes out later today.
But the 44 from one nursing home, because I know there's yesterday
No,
there was like
we are not releasing the number of positives per nursing home. That we're releasing the number of nursing homes that have at least one case.
And you're separating nursing homes you're actually removing them from one to another, or now we're hearing wings possibly. Kind of give us a little bit more of how that is, because I know a lot of people are worried about it's a good idea to separate them.
Yeah, so the strategy with nursing homes is, as the Commissioner Coleman Mitchell outlined yesterday, I think, was to do exactly that, to try to isolate COVID positive from COVID negative, whether that's in a wing of a large nursing home where there can be physical separation, where there can be staff separation. And then we're also working very hard right now to stand up and reactivate closed nursing homes that can be opened back up to become COVID positive nursing homes, either to get people out of other nursing homes or to receive patients who are coming out of hospitals who are not going to be received perhaps back into the nursing home that they used to be in as they continue their recovery. So Commissioner Gifford has been working hard with Secretary McCaw, and we press released earlier today significant additional financial incentives for those nursing homes, both in terms of their rates and potential assistance with startup costs to reactivate some of those nursing homes. But we really need the industry to step up now and help support those initiatives as Commissioner Coleman Mitchell said yesterday, ultimately to help save lives.
What is the latest on that point? In other words, can you tell us five nursing homes are participating as 100% COVID, or 3 or 8? What is the latest? Obviously, you're working on this every day. What is the latest on this?
No further details along the lines of what you shared, Chris, to share today, but suffice it to say that the discussions with the operators are going on around the clock right now, and we're looking forward to seeing forward progress on that in the very near future.
When could the list of nursing homes potentially be released that have at least one positive case?
That'll be in the release today.
Regarding the curve for the graph showing the models, it seems that the peak tends to be late April, early May. I'm guessing the thought process here, though, is that the guidelines, because I want to assure people here that the guidelines don't end once that peak hits, right? Can you give us an idea of once that peak does hit? Because I'm assuming also that would mean a peak number of deaths, as well as a peak number of hospitalizations and infections. When would the guidelines start to either diminish or go away completely? Because I know China is facing this right now, where they are doing relatively well on the basis of infections, but their fear is reinfecting and then going through this all over again.
Yeah. It's too soon to know the answer to that question, but you raise a very important point. When we get across the apex of those curves, that doesn't mean that the next day life goes back to normal, because as you point out, there's still a significant portion of the population that hasn't had COVID-19, and we need to think very carefully and act very carefully that we don't take the restrictions off too quickly and, as you said, lead to another flare-up. So this is why the governor described some of the strategies that we've already started working on, the smart thermometers, the increased testing, elements that we think will give us better analytics to isolate cases, to do contact tracing, to take the measures necessary to give us a path to, in an orderly fashion over time, start to get back to life as normal. But the reality is, Dr. Carter reminds me often, no one really knows at this point, what those actions will look like. And China, as you pointed out, is kind of stumbling through it right now and potentially making some mistakes that we will make sure we learn from.
So it seems like the estimation is the guidelines, at least in some form or another, will be with us for the next several months.
I think that's likely.
Yep.
Governor, with the numbers that you've been giving us today and just gave us just now, are you considering any further restrictions? By that I mean San Francisco style stay in place. Obviously you put in restrictions. What are you considering as far as more restrictions go?
I'm making sure we enforce the restrictions we got right now, Chris. And like I said, we've gone to a lot of these stores where there were some rumors. Frankly, a lot of you have been sending us video clips. If there's a store that's crowded, we go there, we respond quickly, and they don't stay open if they don't honor the social distancing restrictions. We're working like heck with young people to inform them every day. I'm thinking hard about the basketball hoops and telling the mayors, it breaks my heart, but I think the basketball hoops are too big a temptation for a group. I think they ought to come down. I want to keep parks open as long as I can, but you better honor the social distancing, because this is the month where it really matters, and otherwise we're going to have to shut that down too.
If I could just add one point, Governor, to that, Chris. That curve and that peak that the governor described of 12,000 COVID beds and 4,000 ventilators that could be required, we can impact that curve. If people do what the governor asks them to do every single day and take these social distancing measures seriously, we can bend that curve and we can flatten that out, perhaps push it out a little bit, but hopefully reduce the number of infections in total as well. That gives our healthcare system a much better chance to be able to deal with that peak. And so this is why the governor is banging on about this every day. It's so important because people can have an influence on what the shape of that curve looks like.
Now that we have the county-by-county breakdowns of when this will peak, is there a date prior to the peak where the virus might catch up with the resources that we currently have?
Well, I think that's the point about the governor made about, we build the capacity before we need it, right? We're trying to stay one step ahead of that, or actually many steps ahead of that as much as we can. So, right now, again, as the governor said as well, it depends on the part of the state that you're in. We know our hospitals in Fairfield County are more stressed right now. And in Hartford and Eastern Connecticut, it's actually pretty quiet still. That's why a lot of the work that our healthcare response team that the governor announced last week with the 3 CEOs of the major hospitals that have been meeting every day, planning, are really focused right now on Fairfield County, but we're still ahead of the curve in Fairfield County right now as well.
So how many beds do you have? So you need to get to 12,000. How many do we currently have?
Yeah, so as the governor mentioned earlier, we have 7,000 beds in total in the hospital system, staffed beds, of which about 4,000 are available for COVID patients, a portion of those which are actually occupied with COVID patients right now. But we still have several thousand beds that are unoccupied in this state that could take COVID patients.
In regards to nursing homes, we've had family members reach out to us saying that they're only being notified when a loved one has died, not when they are sick. Why is that? Are you guys not allowing people, like, the communication between nursing homes and patients is not, and their families, we're getting complaints that they're not
I
being
don't know what that
told.
would be. I mean, if somebody is ill, they're in regular phone contact all the time. The only thing we've stopped right now is the visitation for reasons of infection. There's no other lack of communication.
Governor, is there any discussion right now from your office regarding masks? I know that the CDC, there's word that they're going to issue a guidance on anyone out in public. Some mayors in other states have issued guidance ahead of that. Anything on your end that you're looking to do at this point?
Yeah, you probably saw in the executive order the other day, we said anybody who can probably should use a mask if you're in a forward-facing job at, say, a big retail establishment. I was talking to one of the major factories that are still under production because it's defense-related. And they want all their people to wear masks. Right now, it's a supply issue. We're working our hearts out to find where we can get masks, not necessarily N95, but just a cloth-based mask that protects you modestly, but protects everybody else. So in those congested places, it really is a good idea to do. In the meantime, scarves and other type of will be an intermediate step. But I think we're going to see more of that type of mask available, and I think that probably will be a CDC recommendation.
Volunteers. You've said you've had like 3,000, you keep getting more and more. Do you need more? We keep seeing more, maybe a different non-medical?
Yeah, we do need more volunteers. Particularly now we need also non-medical volunteers, as you point out. We're going out, we've set up we set up our 211 website for that. We're getting folks. You know, I need folks, at Food Share and Food Bank. A lot of the folks who used to volunteer there, maybe they're a little older, they're staying at home for very good reason. We're trying to get young people to fill in there. We need them to help sort food, maybe get that food to the food pantry. We need younger folks there to be able to help get that food out to folks. And just as importantly, or more importantly, get the food to an elderly person or somebody who's under quarantine. So we're opening up that portal within a day or so. Lisa Tepper Bates is taking the lead on that, and I do hope people step up and help us there.
What the some numbers on testing? At one point that was slowing down, and then it was ramping up. What is the latest on testing? There was some, and frankly,
I think you're going to see it
enough?
continue to expand. Obviously, there's been stop and start with some of the reagents. We found new protocols for the people who are administering the tests so we can save PPE. You heard what we're doing with Abbott. I mentioned Semaphore. So I think you're going to see very good progress, and that means our data and that means our modeling will be a lot more exact.
Governor, based on these models, it looks like we're going into the summertime, and there's a presidential primary that you've put off until June. Have you made any decisions on whether the state should be able to, people who are afraid to go to the polls should be able to vote by absentee ballot?
Look, it makes all the sense in the world to me. I'm sort of navigating the politics around this building right now on that issue. I don't want people going to a voting booth. I don't want them waiting in line. I certainly don't want anybody over the age of 60 or 65 in that position. And I think there probably will be some obligation to have a primary. So we're going to work through that pretty soon. I'll probably do it with all my fellow governors because we're all about on the same date now.
And I'll add to that. Paul Mounds, Jr., Chief of Staff for the Governor. When we moved the original date, we actually were working with our fellow governors from across the state who had a similar date. As you've probably seen, you've seen Pennsylvania move their date, New York moved their date to a later date based upon various guidelines. But we're continuously having the conversations with our other governors about whether or not there needs to be further modifications as deals with dates, especially since the various political parties have changed their overall convention dates as well. As it goes to the absentee ballot front, the governor has asked members of his senior staff to work with the Secretary of State, the clerks, and the registrars, as well as with legislative leaders, to sit down and really come up and see what is the next path forward overall. So we should have some more information on that in the coming days.
Do these models suggest that students might not be going back to school this year?
Well, I'm going to leave that up to Miguel Cardona, but I think you can see the dates on these surges, and it does imply we're going to go way past April 20th, doesn't it?
With the surge in cases expected, what are your thoughts on how the safety of prison inmates is currently being handled, and do you have a response to the ACLU filing that lawsuit today?
I will tell you that we are doing everything in the name of public health. And when it comes to folks who are incarcerated right now, obviously, anybody that doesn't have to be in prison is not being sent to prison. Anybody who's nonviolent or ready to be released, or we're soon to be ready, is out. We're opening up more capacity. The group that I'm most concerned about are the elderly, or the older folks who are in the prisons right now. And I want to do everything I can from a public health point of view where they're safest. Many of them don't have any other place to go. And also in our prisons, we do have extra capacity there. We have negative pressure areas. And that's going to be my priority, the public health of each and every one of those individuals.
Dr. Carter, you know, there's going to be thousands who are presumptive positive either right now and in the coming weeks whose symptoms will not require hospitalization. Is there any medical advice that you would give to them while they recuperate at home of what they can be doing to get better? Is there a diet they should follow, supplements or over-the-counter medicines that they should be taking?
I think that really the recovery from this just takes time. By the time somebody has been sick for 10 or 15 days, many of these people who have been sick at home, the people with mild symptoms, nothing is slowing them down. Actually, what we're trying to do is to make sure they don't go out until 3 days after the fever has ended and the symptoms have improved. But some of these folks are really sick. They haven't eaten very much in 10 days to 2 weeks, may not have had a lot to drink. They just need time. They're weak, they're tired, they just need to recover, and they need space to do that. I don't think there's any single thing that you can take that will help in that situation except to get enough rest, to get enough to eat, and to drink plenty of fluids.
Have you heard anything about a vaccine or where we're at or update, anything positive?
Well, I don't think the situation has changed. A year and a half is still a year and a half. That's what the
vaccines are going to take a little longer. I have a little more hope on the therapies, especially some of these therapies that are already being used safely for other purposes. So I think a lot of our hospitals give me some hope that we may have something in the next few weeks or that would make a difference, at least in terms of trying to mitigate what these surges are. I'll just, leave you in conclusion. Look, this is a tough time for our state, and it's a tough time for our country. There's no question about it. We've been through these tough times before. It took us a while, not so much as a state, but as a country, to really realize the gravity of the situation we're confronting. But I really believe at this point the federal government, the state government, the local government, the citizens understand what we got to do and how we get through this safely and bounce back for a day thereafter. As Josh said, these charts and surges and graphs you see, we can impact that. We can impact that by our behavior. We can impact that by social distancing. We can impact that by doing the best things we can with our hospitals and our therapies and preparing as best we can. We're going to get through this by sticking together, and God bless you all. Thanks, everybody.